heart disease, of course, 600,000 people per year are plagued with heart disease. Prior to 1950, it wasn't this high. What changed? And was it that our genes just dramatically changed in that amount of time, or was it something else?
Yeah. So as you said, heart disease, #1 killer in the U.S., over 600,000 people die each year from it, a lot more affected by it. And worldwide, the #1 killer as well. And it's been that way for 50 plus years. So, when we go back to the early 1900s, we have reports from some of the leading physicians of the time, and heart disease is an exceedingly rare condition. Like I said, leading physicians, the leading hospitals of the time, and, it's rare. It just doesn't exist for the most part. And then, through the early 1900s, it starts to become more prominent. And 1950s, it really reaches the crisis point. And, Dwight Eisenhower has a heart attack while in office as president of the United States. And of course, that set off the alarm bells. And people started asking why. Why do we have heart disease? Why has this? They already saw the noticeable increase from 1900 to 1950, and it's really been an exponential growth since then. And the question that I think is so important to ask today is, okay, 1950, we declared war on this. Like we said, we're putting all our resources, we're going to figure out, what's causing heart disease. And here we are 70 years later, and essentially we've made no progress. Heart disease, like I said, remains the #1 killer by a pretty wide margin. And, we had a little bit of an improvement here and there. But actually, the last decade, we have seen the rates of heart disease increasing again at an exponential rate. So our understanding of what causes heart disease, I would say, went awry in the 1950s. And, in the 1950s, there were two prominent hypotheses about what was contributing to heart disease. And they both had to do with the food that we were eating. It was sugar is causing heart disease, or it was dietary cholesterol and saturated fat is causing heart disease. And for various reasons, we chose to go down the saturated fat and cholesterol pathway. And we started making all of these changes with the goal of lowering our dietary intake of saturated fat and cholesterol. And then it turned into pharmaceutical manipulation of our blood cholesterol levels. And this was supposed to cure heart disease, and it simply hasn't. And, we can get into a lot of aspects of this, but at a high level, when I look at that, the question I ask is, okay, we've done the things that successfully manipulated diet, cholesterol levels, blood cholesterol levels. More and more people are on medications. We've changed our food environment, and the problem is continuing to get worse. And the only way that that can be is if it was never cholesterol that was the real problem in the first place. And so that's led me, now to re-examine kind of our approach to heart disease. And of course, this overlaps with my personal health journey as well. But thankfully, starting about 7 or 8 years ago, I started asking different questions. I started coming across different information. And that has now allowed me to be able to do a better job of not only treating the patients that come to me with heart disease as a heart surgeon, but also now my focus on keeping people off my operating table and helping them to prevent the heart disease from progressing to that point.